Hello, my name is Dr. Jeff Sessions. I'm an orthodontist in Lake Oswego, Oregon, and I'm going to show today how to attach an elastomeric chain to a gold chain and eyelet that's been attached to a surgically exposed tooth. There are times in dentistry or orthodontics where we have a tooth stuck up in the bone. We have a surgeon or a periodontist that'll tunnel up to it. They'll bond a pad, an eyelet, and an actual gold chain. We'll show that to you in a second. And there are times where I want a secondary chain on the tooth. It's an uncommon technique, but I like to do it because it gives me better control of the tooth. So we're going to home in on this right now, and we're going to show you that we need a ligature cutter, 2 hemostats. I like to use 012 steel ligatures. Some surgeons that do this for me will use a slightly larger ligature, but this works, or a larger one work also. So I've already pre-threaded the gold chain with a ligature. And I like to go to the gold chain that's as close to the eyelet as possible. And then this is the trick to attach the elastomeric chain, is you have to have somebody stabilize the base link. And I'm going to do that, and then I'm going to have an assistant come in and just stabilize it for me, because this is a 2-person operation. So we're stabilizing the base link, and then my other assistant is going to come over and stabilize that. And then I am going to take the elastomeric chain, and I'm going to run it down the ligature. I'm going to run it all the way down to the base loop, and then I'm going to do a quick tie off with just 1 or 2 ties like this, just twist it, and then I'm going to take the other hemostat and I'm going to twist it. And the reason we stabilize it with 1 hemostat is if I twist the steel ligature to attach this secondary chain without this backup hemostat, it'll just twist the gold chain right off the tooth, and then the surgeon will have to re-glue it. So once that's stabilized, my assistant can unclick that hemostat. We can, with our ligature cutter, we can cut off the excess. I call this the pigtail. There's a little twist there. I call it the pigtail. And now we have a secondary elastic chain attached with a gold chain, and then the surgeon can place the sutures and let both these chains come out of the tissue. They'll tie it off on a bracket or an arch wire. And then I have 2 chains to be able to guide the tooth into the mouth. I like 2 directions of pull often. The gold chain is excellent, but I like a secondary elastic chain because it gives me better control. So that's what I like to do, and that's how you attach a chain. Thank you.